Good morning. It's a pleasure to be here. One of the problems with being the fourth speaker is that you can think about all those things you wish you had thought to say when you were writing your notes previously. So, I would have changed my presentation after each one of the speakers, but I'm going to just go with what I've got here. My office in the Department of Health and Human Services conducts social science research, develops policy, and evaluates program initiatives for children, families, and individuals. In some ways, we are also a translational research office because we have the dual function of increasing knowledge and then acting on those research findings through the development of policy. We don't usually develop programs, but we do work on the development of policy, that is legislation, regulation, and program models. Much of the research we do would be considered applied research or research synthesis. We evaluate programs or particular models within programs, and we look at the research findings across a number of disciplines to see if there is emerging consensus about relationships that might be amenable to policy interventions. We also fund a number of social science research centers that do basic social science research in the area of poverty and family functioning. We have a national poverty research center, 3 area poverty centers, and we fund a national center for family and marriage research. These centers fund a significant amount of work on the causes and consequences of poverty and the dynamics of family relationships. And as you can imagine, they are very multidisciplinary, looking at economics, psychology, sociology, the whole range of disciplines, and how the activities of families and the activities of society involve poverty and both positive and disrupted family relationships. But one of the interesting things in being asked to speak today is that for the past number of years, our centers have been looking specifically at how poverty and family relationships affect crime and incarceration and are affected by crime and incarceration. And that has become part of the ongoing portfolios of work of those centers. For example, the National Center on Family and Marriage Research has funded and published papers on the relationship of incarceration to men having children with multiple partners, of adolescent drug use and sons delinquency. And it currently has funded 3 studies on fatherhood and incarceration, which will be part of a national fatherhood research conference that the center will be sponsoring in 2012. The 4 poverty centers have an extensive set of papers on the relationship between poverty and incarceration or crime. They focus on health, on welfare policy, on race, on aspects of employment, transitions into adulthood, child support, and have most recently funded a study on the relationship between incarceration and children's food security. And I would venture to guess that most of the folks in this room have never been to the websites of any of those centers to look at what they are, the kind of research that they're producing that directly affects the work that you do. But for us, the issue is not how to think about incarceration and crime as part of the context in which poverty and family relationships are studied, but how to translate the findings into something that is useful and operationally accessible to policymakers and program operators in both the criminal justice field and in health and human services. And I just want to give an example of one of the projects that we've undertaken in that arena. So about 5 years ago, Congress appropriated $150 million to fund responsible fatherhood and healthy marriage programs. It was the first such funding that had happened. We were sort of fresh off of a research conference that had happened a couple of years earlier. We had funded the Urban Institute under the leadership of Jeremy Travis, who some of you may know, to hold a conference on the relationship of incarceration to children, families, and communities. And from the findings of that conference, which gathered researchers from all kinds of discipline, we knew, or thought we knew, as is the case with research, a number of things. One, that incarceration disrupts family relationships, that positive family relationships seem to contribute to successful reentry, and also that there are interventions that appear to strengthen family relationships. Now, those interventions had never been tested in the context of work with families where one of the partners is incarcerated. So using part of the $150 million, just a small part of that $150 million, HHS published a grant solicitation that encouraged applicants to submit proposals to do marriage and family strengthening programs for incarcerated fathers and their partners in prisons. And we also contracted for an evaluation of those programs to see if they actually strengthen family relationships and contribute to more successful outcomes post-release. We don't have finding yet of the impact of this evaluation. Those will be coming out in the next couple of years. But we've learned an awful lot about the complications of doing family interventions in the context of a prison environment. And I want to just mention what those are, but first I want to just very, very briefly talk about what the intervention is. And so the intervention in a family strengthening program is to basically help couples develop relationship skills, centering primarily around communication, that help them be able to discuss their relationship, discuss problems, discuss issues. They learn skills relating to empathy, skills relating to anger management, things like timeout before you speak when you're very distressed. And these relationship skills programs have been fairly well tested in environments other than prison environments, and have shown to have positive results for up to 5 years or longer. So that's the intervention. But what we've learned that trying to do that kind of intervention within the context of a prison environment is fraught with difficulties. And here are some of the practical issues that have to be addressed in terms of that. One is getting the buy-in from the prison staff, from the warden all the way down to the security guards, because one of the things that these programs mean is that you have people from the outside, that is visitors, coming into the program and sort of disrupting the way the prisons are usually operated. You have to find usable space, because these programs require that the couples do these interventions together. And there is often not very usable space in the context of prison, which is accessible to folks from both the inside and the outside. You have to have trained facilitators that can deliver the services, that understand the nuances of developing these relationship skills, and that either means importing people from the outside, that is external facilitators, which has its set of problems, or training people inside the prison, current prison staff, to deliver those services. You have to have an appropriate curriculum. I mentioned that these programs have been tested and found successful, but not necessarily with this population. So how do you develop or modify curriculum so that the exercises, the skills, the examples that are being used are appropriate for the population that is currently in prison and having a set of stressors that may be substantially different from those of couples on the outside. And then lastly, there's a whole question of the timing of the intervention. Are these, if we want to keep couples' relationships together, are these kinds of programs best delivered at the beginning of someone's sentence, because that's when those relationships are the strongest and you want to make sure that you maintain those relationships over time? Or is it best delivered at the end when the incarcerated individual is being released and will be going back to their partner or their community? But by that time, many of these relationships have in fact disintegrated. And so you've lost the opportunity to help maintain relationships that maybe had a chance. All of these issues have made us think very hard about whether or not this kind of model is even viable within a prison context. I mean, we don't even have the results yet, and we're already questioning whether or not this is a very good model, because we see that the implementation of this may in fact have higher cost to the sort of the institutional operation of the prison than most prisons would be willing to absorb. So, we're going to be looking at some alternatives. We don't have any plans for evaluations of them, but there are models which include just doing the relationship education for men only, not with their partners, that is, assuming that the kind of skills that they increase through these programs will have some effect on their ability to maintain positive relationships with their partners. And another model that we're looking at, in fact, was used in some of the sites, but not on a consistent basis, is to sort of do an inside-outside program where the couple are actually taking the same course, but are taking them separately. So he's doing the work in the prison, she's doing the work in classes on the outside, and opportunities are provided for them to discuss sort of what they're learning in terms of that. So that's sort of an example of how we're trying to translate research. I think from our perspective, there's sort of a global thing we'd like to say is that you have to know the research. That is one of the things that often we find policy agencies don't, or program agencies really don't know the research. And to translate it into practice, you have to know what the research findings are. You have to be prepared to take advantage of opportunity. The fact that Congress passed this appropriation was not something that we had planned on, but we were ready when it happened to do something different. And then you have to keep your eyes and ears open to see how the field is changing, because the research findings that you might be acting on may in fact be out of date and not current with what the new research findings are.